Welcome to the Crimson Dossier. Every case has a file. Not every file has answers. Part 1. In 1988, a young woman walked into a Moscow hospital to donate blood. Routine procedure, but the test results came back with something that shouldn't have been possible. Not in the Soviet Union. Not here. She had HIV. And the trail of that single case would lead investigators to a military man, a port in Central Africa, and a pediatric ward where hundreds of children were being silently killed by the very people sworn to save them. It started with a baby who died without a name on its cause of death. Elista, 1988. Capital of the Kalmyk Republic, deep in southern Russia. A newborn dies in a local clinic. Doctors find nothing definitive. The case is filed away. But the mother survives, and months later, that same woman turns up at a Moscow infection ward after her blood donation triggers an alarm. The investigation reveals something almost unbelievable. She contracted HIV from her infant. During breastfeeding, the virus passed from open sores in the baby's mouth through micro cracks in her skin. Her child had HIV, had always had it, and died before anyone knew to look. The question that changed everything: where did a newborn get HIV? The Soviet government had been telling its people for years that AIDS was a Western disease. A capitalist disease, a disease of junkies, homosexuals, and Africans. People who deserved it. It could not exist here. That lie was about to collapse. Through the country's new anonymous HIV testing network, one of the first public health concessions of the Gorbachev era, a man came forward voluntarily. Middle-aged, married, a career military officer. He had served aboard a naval vessel. During a port call in Congo, he visited local sex workers. He came home to his wife. His wife became pregnant. Their child was born with HIV. That child died in Elista. That child infected its mother. And that mother's case unlocked what was already spreading, invisibly, through an entire pediatric ward. Epidemiologist Vadim Pokrovsky, son of the USSR's chief medical officer, was dispatched to Elista to find out how far it had spread. What he found was not a mystery. It was negligence on an industrial scale. Nurses were reusing syringes, not the full syringe. They were changing the needles and calling it sterile. 1 in 3 children was being injected with equipment that had already been used on another patient. Feeding tubes, inhalation masks, surgical instruments. Disinfection protocols existed only on paper. This wasn't unique to Elista. This was standard practice across Soviet healthcare. Resources were scarce. Time was short. Nobody had ever been told why it mattered. By the time the investigation concluded, 75 children infected in Elista. At least 35 in Volgograd. Over 118 confirmed cases in the Rostov region. The virus had also entered a batch of immunoglobulin, a drug being administered to children across the country. The true total was never counted. Part 2. When the state television program Vremya announced the outbreak, it didn't just inform the public. It ignited them. Protests outside the Elista hospital. Families of infected children called plague carriers, spidonosci, forced out of schools, fired from jobs. Relatives cut contact entirely. One mother attempted suicide twice under the weight of the stigma. A 1989 survey found that 24% of Soviet citizens supported isolating HIV carriers. 13%, 1 in 8, supported liquidation. Not one of those survey respondents was asking for the nurses to be prosecuted. The criminal case against the medical staff was opened and closed in 2001. Statute of limitations. No individual was ever held criminally responsible. The survivors eventually received financial compensation described by one victim's family as an insult. The man who started it all, the sailor, the zero patient, died in the years that followed. Those who knew him say he lost his mind before his body gave out. He never forgave himself for what he had set in motion. 75 children, hundreds more across the region, 24 dead within 9 years, in a country that had no treatment and no framework to care for them. The Soviet state had spent decades insisting that AIDS could not exist within its borders. When it arrived, the system had no syringes to spare, but it had plenty of silence. This has been the Crimson Dossier. If this case is new to you, share it. The people in this story never got justice. The least we can do is remember what happened.